The first thing is you've got to get prepared. It means if your dog's not scheduled for surgery for a while, get everything you need in your house. That means all the supplies, a harness, 2 cone collars. I've got a video about that explains why you need 2 cone collars, not just 1. You want to have all the supplies that you need from the grocery store in your house before they go in for surgery. You want to take some of those items that you've bought, such as the cone collar, the harness. You want to get those things sized ahead of time. You want to even try using them so that when your dog comes home, you'll have an easier time. Your dog will too, having had just a little bit of experience using that stuff. The next thing is you want to avoid post-op injury. How do you do that? You make sure that the floors are covered and not slippery. That might mean you throw down some little carpet remnants with that non-skid material on the bottom. Maybe you unroll some yoga mats and you make little runways for your dog to walk on. Get your dog used to walking around on those, so that post-op they will actually use them and not walk around them. You want to make sure that if your dog is not crate trained, that you don't ask them or force them to go into a crate post-op and then worry about them escaping the crate. And believe me, some dogs do it. I've seen so many pictures of busted crates and dogs that are hurt post-op because obviously their leg can't handle all of this digging and running and jumping and pushing. And so what does that mean? Sometimes you have to go back to the surgeon to get attention for this now second injury to their leg. So if your dog's not crate trained, make a really nice little recovery area. And if you've got time to acclimate them to that before surgery, do that. Make it a positive place that your dog wants to be in. That might even mean you sit in there with them, read a book, watch TV, pet them, give them a massage, whatever it is. Hang out in there and make it a really nice place. All right, now you probably know this. With COVID-19, everybody's ordering things online. What does that mean? Even if you're an Amazon Prime member, like I am, we're having to wait like 2 weeks for things to get to us. This I've seen lots, where people are ordering their harness. Their dog's scheduled for surgery tomorrow. They're picking them up, but the harness isn't going to be there until, a week from now, and their dog weighs 100-something pounds. You don't want that. If that's the case and that's happening, you need to go online, go to YouTube, and I want you to search for how to make a sling from a canvas grocery bag. Yeah, you can do it. They're not the best, but you might need something if you have a larger dog or a heavier weight dog. If that doesn't sound good or you don't have a canvas bag, then you can use a towel sling. It's a sling that you're going to make using a folded up towel, and you're going to put it under your dog and get them used to walking with that to get outside. It is not optimal because it's hard to carry a bunched up towel, especially if your dog weighs a lot. So you want to make sure that you get all of your stuff ordered in ample time. Let's talk about physical therapy. What if the PT place is closed? What are you going to do? Guess what? You can do PT yourself. Now there are some things we cannot do, and that would be cold laser therapy, acupuncture, hydrotherapy. Well, we don't have access to that stuff, but you know what we can do? Figure eights in the yard, sit to stand. There are lots of exercises. I'm going to make a video for you guys who are interested in doing PT at home. Really, you can do it. If you're scheduling surgery, make sure that you have a way to ask the doctor all of the questions before surgery. What questions do I ask? Don't worry, I've got it done for you. I've got a 3-part YouTube video series, and you can click on it over there. There's part 1, part 2, part 3. Watch all of them, and it'll go through each of the questions to ask the surgeon and why you should ask. If you don't want to watch the videos, you can go to runagainrover.com, my website, and in the blog section that is titled, I think, Learn More About CCL Injury, you can just keep scrolling down, look for the blog post titled Ask the Expert, and that will go through all the pre-op questions and post-op questions that you should ask before surgical discharge. And so you might have to email those questions to the doctor, or maybe you can have a phone conversation or a Zoom convo, something like that. But you want to make sure that you are going into surgery feeling good and that you know what to expect from the surgeon, and that you've asked the questions that you're wondering the answers to. Now, since we don't have a lot of access to the surgeon, we want to avoid going in there in the first place. Now, we will have to go for the 8-week checkup. Some doctors do it in 6 weeks. We certainly can avoid unnecessary trips to the surgeon by avoiding injury. You've got to do things, you've got to actually be more cautious than maybe some people were in the past who could take a trip to the surgeon if they needed. Make sure that your dog does not lick the incision, because if they do, you're going to need more antibiotics. You might need to have to bring your dog back in to have the incision closed back up again. It means that your dog could get an infection right now or months down the road. So take precautions to not allow your dog to lick the incision. We don't want to have any kind of crate escapes, jumping over boundaries that you have set up around them for their recovery area. You don't want them to have access to jumping on beds or couches, so that might mean that you tilt the couch cushions or you block the couch off. I've seen dogs still jump over boundaries, so you've got to be super careful. Maybe you turn your couch around. I know it's not ideal, but if you do that, some people flip their couches upside down. It will look like a crazy person lives at your house, but you know what? Your dog won't jump on the couch and hurt their knee again. We've got to take these precautions so that we don't have to make an emergency trip to the vet. If your dog is super reactive, make sure you hang some signs outside that tell people don't knock on the door, don't ring the doorbell, and don't call for me, because if you do, my dog will bark and then I will have to come out and wring your neck. Also, if your dog is reactive, don't set their recovery area up near a window where they bark and go crazy when they see the postman or the Amazon truck or the neighbor walking their dog. You want to set them up in an area that is quiet, where they can still see you, and where they're going to be happy and not reactive. Next thing is, we want to avoid injury by walking our dogs where there are unleashed dogs. I have seen so many situations where dogs are getting attacked. It's almost like the other dogs recognize there's something wrong with ours. Our dogs obviously know something is not right. They're vulnerable and they're more reactive. The other dog senses it. Some people, they walk their dog without a leash, and what happens? The dogs get into a scuffle. Whose dog gets hurt? Ours. What does that mean? Back to the vet. What does that mean? You have a big problem on your hands because you're in a big, long line of cars of people waiting to go in to talk to the surgeon, and now you can't talk to the surgeon to figure out how to fix your dog. So avoid it by walking your dog in your yard. If you have a good yard that's sizable enough, that is predictable. That's what I like about keeping the dog in our yard. If you have a fenced in area, walk in there. Now is not the time to go to a dog park, and it might not be the time to even walk in your neighborhood if you have lots of other dog walkers. Make sure you get all the dog's medications before you leave surgical discharge. I've seen cases where people leave without the antibiotic. They leave without the pain meds. How does this happen? It's the vet tech and the vet nurse and the vet. It's their job to make sure that your little packet, your little bag that you leave with has all the right medications. Sometimes they forget. They're human. They make mistakes. They're rushed and stressed out with this COVID thing too. Before you drive away, make sure that you look at the discharge instructions, and it might say Tramadol, Metacam, Gabapentin, whatever the drugs are. I want you to make sure, look, okay, yep, there it is, there it is, there it is. Make sure you have everything so that you don't need to make an unnecessary trip back. Before you leave the surgeon's office, ask for a cell phone number or an email address. I like the cell phone better because if there's an emergency, you have somebody that you can contact right away. You need a way to get to the doctor, to ask questions. You can't do it by just taking a drive over there. So get a cell phone number. This way, if the incision is looking bad, if they licked the incision, if they're throwing up, if it looks like they're walking weirdly and something is really abnormal about it, what do? Take a video, take a picture, and send it to the doctor, either by email or text message. Now here's one thing, guys. I've seen lots of people in my Facebook group post pictures and they'll say, there's a picture, and they'll say, what do you think, guys? This is 3 days post-op. And they show the incision, and I'm looking at it and I'm like, it's all blurry. I can't see anything. I see some fur, I can tell it's a dog leg, but that's it. If you're gonna send the surgeon a picture, it's gotta be really clear. How do you do that? You're gonna take your phone, aim it over the incision, tap your phone screen, and watch the fine focus really get in there and make that incision look super clear. If you're taking video, hold the cell phone, tap the screen if it doesn't look clear to set the focus, and then get the video. We want high quality images to send to the vet. Don't waste their time with junky, blurry pictures and bad video footage. Another thing I know you're probably so worried about if you have a reactive dog, my dog is reactive too. One of the things that I think people are so nervous about is not being able to go in there with their dog, go into the veterinary hospital with their dog. Let me tell you, I want to just, I hope that this helps you feel a little bit better. These vet techs are amazing people. They're like animal whisperers. They know how to deal with reactive dogs, anxious dogs, and half the time, you know who I think is more anxious? We are. Once the dogs get away from us, they actually sometimes, I think, do a little bit better. Have faith in that surgical team. They know what to do. Hand your dog off. You've already picked that surgeon for a reason, right? You liked what you read online. You liked what they said during the surgical consultation. You've read the website. You've read reviews. You already have decided. That means you're feeling good about that doctor. Feel good about their surgical team. Know that your dog's in great hands. It won't be long. Your pup will be back at home, and then you're going to go right into recovery mode. You're going to do a great job. I hope this video helped to ease some of your nervousness and calm you down a little bit. I wish you the very best with your dog's recovery. I'm here to help you. If you've got any questions, go ahead and drop a comment below, and maybe your question will be the topic of my next video. Now, if you like what you're learning, click the red subscribe button. That's going to help my channel grow. If you want to know every time I post a new video, you've got to click that little bell icon, and you'll get a little ping notification when the new video goes up next week. Thank you so much for watching. Best of luck to you.